being able to secure denture with them. You're watching Medical News Network. We'll be right back.
Whether you're expecting or looking for that perfect baby shower gift, we have you covered, baby, at PregnancyStore.com. Relieve morning sickness by listening to Morning Well's unique blend of music, special frequencies, and pulses. The Serenity Star Body Pillow is many pillows in one. It supports you while you're pregnant and makes an amazing nursing pillow. PregnancyStore.com. It's the one-stop shop for moms-to-be.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're talking about easy options to obtain the beautiful and healthy smile that you've always wanted with Dr. Joe D'Angelo. All right, before we went to break, we're talking about veneers. We've got some cases that you've worked on, and I want to talk a little bit about the artistry and the technique that goes into getting the proper look. The first one we're going to look at here is a young lady. Tell me a little bit about her.
Well, this young gal had tetracycline stain. Tetracycline is an antibiotic that is given sometimes to children with certain infections that does tend to accumulate in the tooth and turns it dark.
Okay, now, and that's what makes it turn that dark color as we see on the left-hand side there. Why are her front teeth so white still?
Well, she had veneers placed at an early age, perhaps a little too early, but I can understand why she did it. She was very embarrassed about the dark teeth. They were close to black. And
is there an age? And I know that obviously every case is different, but in the right circumstances, is there an age that you should wait to have veneers done? Should you wait till you're 18, till your teeth are fully in, if you're able to?
Well, ideally, I'd like to see somebody wait until the tooth is fully erupted, so that we know that we have a stable margin position. Otherwise, something like this could happen.
What age is that usually around?
Usually around 15 to 17 for girls and 16 to 18 for boys.
Okay, and when you mean, so all their teeth are in, they're not going to continue to move. So what did you do for this young lady?
Well, this young lady had veneers placed at a young age, and you could see from the picture that one tooth is still dark on the top arch. And that tooth is stained just like the other ones, except for the ones in the front had veneers placed. And since the veneers were placed, the teeth erupted a little bit more.
Is that what causes that like yellow line over the tooth right next to the colored one?
That yellow line is the tooth that's not covered with the veneer. So she didn't like the veneers themselves, she didn't like the yellow line, and she didn't like the dark tooth that wasn't covered.
So you can actually fix veneers if they're not, and maybe they weren't done right, and in this case her teeth continued to grow, and obviously we know that happened. But just because you have them put in, if they don't look right, you can actually fix them, take them off,
and many cases that I've done are actually redo cases. So somebody came in, they didn't like a case for some reason, or they didn't like how the teeth looked, so they wanted it redone.
And you're able to take care of that?
Oh, most certainly. And we just take them off just like we're preparing a tooth the first time.
All right. Well, let's take a look at her after picture and see the difference.
Now,
now, did you redo? You must have redone all the front teeth.
I just redid redid the front four and then added 2 more teeth.
Okay.
Okay. She
now, does she have to worry about that stain coming back through?
No. We very successfully blocked the color out. And
now,
she's not likely to get any more recession unless she doesn't take care of the teeth.
On that particular occasion, I know how you talked about doing each individual tooth as a single unit. Was the veneer for the tooth that was darkly colored, was it done differently to hide the color than you would normally do a veneer on a tooth that wasn't stained?
Well, in order to hide that severe a color, I like a little bit more dimension on the veneer, so it might be a slightly heavier preparation.
Okay, and so tooth color can be hidden. Obviously, the teeth now, and you said the reason they didn't line up before was because they continued to grow. She has a much nicer smile line here.
Well, this was just, they have nicer shapes. So yes, the smile line follows her lip a lot better.
Do they have nicer shapes because you think the dentist that did these did a better job?
Most definitely.
All right, let's take a look at the next case. Now, tell me about this gentleman.
Well, this gentleman had crowded teeth. He's had them for years like this. He never liked them, and
now,
finally...
Is that one in front, it looks like it's broken off. Is it broken off from banging on the other teeth?
Yeah, that tooth is so severely rotated that it's just about sticking out at you.
And I notice his teeth they turn almost to a brown down towards a grayish towards the tip. Is that just from
He's got
staining?
A little bit of translucency there and some staining, yes.
Now his teeth also tend to be extremely crowded.
That's what his major complaint was. He didn't like to smile because his teeth were so crowded. He was embarrassed about it. And then finally he just decided he's going to do something about it. He knew I did veneers. And he was a long-standing patient. And he told me, listen, there's no way I could go through braces. I want to have something done, but I can't spend 2 years in braces.
Are you telling me he can basically make them look like they're not crowded as crowded with veneers?
Well, that's what we did for him.
How long did it take you to fix his smile?
He was done within 2 weeks.
All right, let's take a look at his after real quick. So his teeth look straighter. Now, how do you make the teeth look straight? Do you just grind down, or do you down the one behind it smaller and then put the veneer over it?
Well, what we do with a case like this is we start with something we call a diagnostic wax-up. Take a model of the teeth. I have my lab, according to my direction, make a set of veneers on those teeth that are in the right form, the right length, the right width, and then from there we prepare the teeth differentially in different parts depending on whether one section needs to be brought out, another section needs to be brought in, and we find a position that makes sense.
Okay, I have a question about that, but I also want to ask you, did you do anything to his bottom teeth other than just whiten them?
Oh, we just whitened them.
And then you made the top ones to color-wise match the bottom?
Correct.
Because otherwise, well, you're talking about the wax-up. Is that something that's standard practice? Do most dentists do that before they do veneers?
On most veneer cases, I do diagnostic wax-ups.
Okay.
Because most of the time we're changing the shape, the length, closing spaces, and...
Do you think that's a standard practice by most dentists?
It should be, because I think it's a
Is that a polite way of saying no?
Yeah, it's a polite way of saying no.
Okay, and that's what I asked you before about the making sure. How do you know when you start messing with bites and stuff, how do you know before you do it that it's going to work when it's over? Is that why you do the wax up?
But not only do I want to see what the possibilities are, I want to see what can practically be done. In other words, is this possible on a model, kind of like an architectural plan? Can we do this?
And does that normally mean that your rate of success of achieving what you're looking to do for or do with that patient is much greater because you take the time before you start to see what it's going to look like at the end?
Right. It gives me a plan, a direction to go, and more specifically, I know, and the patient knows, what we could do for them.
Okay.
So they go in without the fear of not knowing.
All right, let's take a look at the next picture here. Tell me a little bit about what's going on here.
Well, this gal came to the office, and she had some spacing between her teeth. They were a little too short, didn't show very much, a little bit yellow. They were rotated. There's just a multitude of things she didn't like about her teeth, and she just was ready for a new smile.
Okay, how many teeth can you actually change using veneers in the front? Can you change the entire smile line?
Oh, sure, as far back as you can see.
All right, what did you do for her?
Well, we did 8 veneers for her, going around to the first premolar, which is a tooth just behind the cuspid.
All right, let's take a look at her after. Wow. Now you're actually able to rebuild those teeth, especially the ones that were too small, build them up using the veneer?
Well, I could change the shape to just about anything I want.
And how strong is that?
These teeth will be as strong as the teeth were before. I mean, she could pretty much bite into anything. I usually advise people not to do anything stupid like biting their nails or trying to open up bottles with them, but I see so few breaking that strength has not been an issue at all.
If you were going to go get veneers or have veneers done, do you think you're better off finding somebody that's done them for 10 or 15 years and has done hundreds of them versus somebody that maybe has just graduated from school?
Well, it's just like anything else, Mike. If you want something to be done that's as technically and artistically demanding as veneers, I would want to have somebody that's done a lot of them, because over time they're going to get an intuitive sense of what's going to work.
All right, we have to take another quick break. When we come back, I want to talk about implants.